I love clouds. Monday, March 8th, 2021. Welcome everybody to our monthly village meetings. This meeting is being recorded for the benefit of those who can't join today, since we're discussing so many different interesting topics. On the agenda as a whole is our vaccinations, clinics, yes, no, where, and how. We also have wonderful guests from our Lifelong Coalition. Some of you may have already heard me talk about that. Some of you have not. So we're going to let them share what's been going on and what we can do together. And then we'll just open it up for just general flow of sharing ideas and suggestions. So let's plunge into the world of vaccination. Actually, we don't have a lot of people. So if you would like to just say your name and what village you're with or organization, so that we'll know who is present. And we'll start with you, Nancy.
Yeah, Nancy Aronson, Burning Tree Village.
Harvey.
Graham Kelty, Bannockburn Neighbors Assisting Neighbors, or NAN.
Thank you, Miriam. Harvey.
Greater Stonegate Village, Harvey Flat.
Katie.
Hi guys, Katie Temple, Habitat for Humanity, Metro Maryland.
Doug.
Doug Gaddis, Silver Spring Village.
Jane.
Did you say Jane?
Yes.
Jane Wilbur from Greater Stonegate Village.
Jean.
Jean McCarskey, Village of Kentlands and Lakelands.
Teresa.
Teresa Anderson with King Farm Village.
Jim.
Jim Grueth, King Farm Neighbors Village.
Erico.
Erico Kennedy, Chevy Chase at Home.
Becky.
Becky Freeze with Habitat for Humanity, Metro Maryland.
Lisa.
Lisa Rosenthal, Little Falls Village.
Dick. Blah.
Dick Aaron, Wingate and Maplewood Neighbors Helping Neighbors.
Joni.
Joni Keaton from Rebuilding Together, Montgomery County.
Eddie.
Eddie Rivas, Potomac Community Village.
Connie.
Anna Rao, Friendship Heights Neighbors Network.
Trish.
Trish Evans, City of Rockville Village Facilitator.
Lindsay.
Lindsay Loon with Rebuilding Together, Montgomery County.
Louise.
Hi, everybody. Louise Smoke, Friendship Heights Neighbors Network in Little Falls Village.
Abby.
Abby Sims, North Chevy Chase Connection.
Elizabeth.
Elizabeth Hale, Bethesda Metro Area Village.
Joe.
Hi all, Joe Isaacs from Mill Creek Village in Durwood.
This is a phone number. I'm not sure. Is it Mike? Who's joining us by phone?
Mike Valanda, Villages of Kensington.
Mike, I recognize your phone number. I'm just so impressed. Loretta.
Hi.
Hi. You want to introduce yourself and what village you're with?
Sorry. Yes.
You've arrived just in time for that.
Okay, Loretta Vitalis Sachs. I am with Helping Hands University Park. I'm the chairperson and defender.
So for those of you who haven't joined us earlier, we have two main topics for our agenda, and then we'll do a free-flowing Q&A. The first one is vaccination clinics and vaccinations overall. The second one is Lifelong Homes Coalition and their wonderful plans for us as villages in the county and beyond. So let's plunge in directly into vaccinations. For those of you who weren't part of some previous conversations, Little Falls Village was successful in securing Giants vaccination, about 200 dosages to vaccinate members and volunteers about 2 weeks ago, and had since wanted to advocate for additional villages to do the same. So we had a short meeting about last week, and we decided that all villages who are interested can get their sort of, initial approval from their leadership to become a lead if enough vaccines and sites are identified in organizing clinics for their communities, and that Little Falls Village would offer training on how they did it and what worked and what didn't work. So this is kind of a recap. I don't know that much have changed from state level in terms of their formal guidance on who is going to work with who and if Giant can or cannot work with villages. If any one of you have heard anything different, I would be happy to hear. Overall, it's been a little difficult to communicate with state. I think they have a lot on their plate, and so it's been challenging to understand where things stand. So I'm going to just open it for you right now if you have any comments to make. Yeah,
I
Lisa.
saw an email on Friday where they had a link and they were telling people that you needed to apply, click on that and just answer some questions about.
Link from who?
Oh, God. Louise, do you remember who that was from? That was one of the notices that we got. It was, let me just pull it up because
Okay.
I had.
Take a moment. In the meantime, Andy, do you want to introduce yourself? You're just joining. Andy says hi. From the village of Tacoma Park, if you're struggling with your mute button.
That's me. Thank you.
Hasn't changed. All right, while Lisa does that,
Are there any villages who's not from Carolyn Chen? Carolyn Chen sent it.
I haven't received it, so do you mind forwarding it to me?
Sure, let me do that.
Go ahead, Miriam.
Are there, can you put your hand up if you feel you have a substantial number of people who are not yet vaccinated or have appointments? So
that means
no hands up. I know of, in our village, I know of only one person who's, I think 103 or 4, who hasn't been vaccinated yet.
Though she wants to?
She wants to, but she doesn't use her computer, et cetera, and
you and I should talk about that because we have a way of just
doing it
expediting
at home, right.
centenarians. They have
Yeah.
a special place in our hearts.
So we can do that, but I think there's a lesson in this. I think what Lisa arranged is great, but for most of us, those ideas were rejected trying to go through the system originally, or I should say not acted on. We didn't get any response. So this is the second time in my experience that I was involved in an effort to develop a policy that would be uniformly applied to villages. And that effort was unsuccessful. The other one involved use of county libraries for village meetings. And at some point, we should put this on a to-do list and try to work toward uniformity of policy, or at least as an optional choice for villages when we're trying to deal with the county. And I think it's important in the interests of equity.
Yep.
Thanks, Miriam. Yeah, I agree with that. We don't really have that many that are still needing vaccines. We remain interested in helping people in other areas of the county, whether that's helping them register or helping run clinics in other areas that have a need. So I don't know if anything has happened with that volunteer effort where we sent you, whether we were interested in doing that, but I'd be interested in working on that.
Okay, so what I'm hearing, unless if others want to join in, is that individuals have successfully been able to find, most of the people that you're working with have successfully found vaccinations through either county or other providers, and that currently, if we're talking about your membership specifically, there isn't sufficient number of interested people to justify an effort.
We have probably 25% based on the survey that we did. I would say that if I extrapolated, it's 25% who have not been able to get a vaccine within comfortable driving distance.
So does that mean you would want to hold an event?
We would hold an event as long as we could also vaccinate similar population who are not village members in the interest.
I hear you. Eddie?
We're currently, this week, we're going to be polling all of our members. We know members have gotten them. We know there's board members, that's myself included, who are nowhere near getting it. And so we're polling all of our members this week to get a sense of what the need is.
Okay.
But in discussions about having a clinic, we decided not to follow up.
Okay, that sounds good. All right, so I think there's so much to do. We're not going to pursue things that are not of great interest to a good number of you all. And so what I suggest we do is this. I still want to follow up on my suggestion to forward lists of volunteers over the age of 65 who hadn't received the vaccine yet, so we can invite them. I've gotten a couple of your lists, but not all of them. So please follow up on that. If you have a centenarian amongst your membership who hasn't gotten the vaccine, please let me know. I'm going to try and put that.
Well, and I would say even if you just have somebody that's over 75, thank you to Pazit for the number where we should contact people directly. Our remaining 75 pluses last week after I contacted the county, they were scheduled immediately.
Yeah, and because once we open the next year for 65 and over, we actually have shifted the way we approach 75 plus, and they are a higher priority. So whenever somebody who is 75 plus and hasn't received the vaccine, contact us at the email c19vaccinations@montgomerycountymd.gov. They will be reached for an appointment schedule.
Is that just for people that are 75 and over, Pazit?
75 and over.
And I just sent you the email, by the way.
I can't hear two people at the same time. So Lisa, finish, and then Abby.
I just sent you the email that you asked for.
Okay, cool. Abby.
Could you repeat the email address that you just?
Yeah, I'm actually going to put that in the chat box so that I'm not confusing anybody and it's on the record.
That's 75 and older only, right?
75 and older. I mean, you can call for this for other things, but right now we really try. So what happened with 75 plus, here's what county has done so far, and just to give context. We had made efforts to serve all those who are 75 and over. Anyone that pre-registered who was over the age of 75 received already an invitation to get vaccinated. Everybody, according to county. However, we've been hearing from lots of people who said they pre-registered and then they say they never got a link invitation to a vaccine. So there is a breakdown in communications, and there could be many reasons for that. But right now, it doesn't really matter what the reason is. We just want to hear from people. And if you email to this address I had given in the chat box, c19vaccinations@montgomerycountymd.gov, and say I'm a 75 and over person.
Sorry, furnace and water heater.
Oh, can the person that opened the phone, I think there's like, can you please close that? Just mute yourself or whatever.
You'll probably have to mute them.
Can I mute them?
Yeah, because you're host.
Oh, I feel like that's such an abuse of power though. Okay, who do I mute?
It's the telephone number.
Okay, let me just scroll down and see where the phone number is. I'm not even seeing the phone. Oh, it's quiet now. Okay, no need to abuse power.
Question though, Pazit. We do have a couple people who are waiting for their physicians to call them in for vaccination, or at least one person, and then are homebound.
Let's talk about homebound in a minute. Let me just, okay, I do need to mute this.
Kaiser is calling people in by order.
Are you looking for? Oh, I thought there was a power switch.
Mike Landa, can you turn off your phone,
Might be
please?
that switch on the wall right there. I'm not that's the
Oh,
light.
I'm muting people. I shall just mute all. Oh,
Yeah,
thank you.
I'm muted. There it is. I got it. Where? It's over here.
Yay.
People, I mute them and then they unmute themselves. Okay, do we have quiet? Yes. Eriko, go ahead, go back again.
So there's one of our members who insists that she's waiting for her physician.
Yep.
And she won't leave the house.
Okay.
So, and that's okay, we can let her wait.
Yep.
But just, one of the things as you're thinking, problem solving, strategizing, we do have somebody who's 24-hour care. So
Yep.
just, that's what we have left.
Yep.
To access.
Eriko, do you know if the person is a Kaiser member?
She's not going to go to Kaiser. She
Oh,
wants
okay.
her doctor
Well,
private
cancer
physician.
is her doctor, if that's what she uses. Yeah, okay.
Well, free choice. We're still in that world, so let's make sure that she gets the decision to make her own decision. Abby?
Quick question. So I want to put out this email that you just gave me. And what exactly do I say? If you're 75 and older,
Yes, and pre-registered already with the county, but have not heard from us, please email us so we can send you an invitation to come to a clinic because
Okay.
you are currently prioritized.
Okay, thank you.
And is it better for us as villages, if we can manage it, to make that call on their behalf?
Yes, you can do that.
Okay.
It's a good idea, Doug. I want to go back to the
is there
idea
a
of homebound. Hold on.
Is there a telephone number to call? I think Elizabeth mentioned that.
Yes, there is a telephone number. I mean, usually leave a message because they're so inundated. If you can send an email, I think you'll get a better response, but I'm going to put the number as well for people who want to make the call. Homebound, I want to close that loop on that discussion. We are aware of a few hundred people who are homebound, at least as they have self-identified on our pre-registration. I'm thinking there are more. And we're in the process of identifying who of them are indeed homebound and who can just benefit from a transportation help. So there's two components to it. One is the vetting of the people who say they're homebound. And then the second is the actual implementation of a plan. We have one provider already in very advanced stages of contracting with the county to deliver vaccinations to her patients who are homebound. And that's a very exciting development. I want to thank Erico for resharing the vaccination valet, because we're going to reach out to them and see if they would be able and interested in helping us reach our homebound population. And we're also talking to certain home care companies, home health companies, sorry, who have the ability to get reimbursed by Medicare, Medicaid for this service. So that would probably a multi-agency effort in getting to people, as many people as possible in the community. Currently, the effort you can help with is simply ensure that those who are homebound, when they pre-register, they indicate that on the form so that we can then reach them, vet them, and add them to our list of people who need to be served at home. Any
So
questions?
is Vaccine Valet, is that the provider that's working with you right now?
Let me be clear. We're in contact stages with all these providers. I've reached out to them because that's their forte. But it's very early. We don't have any firm contact for you to reach out to and request this kind of support. I'm also suspecting that it would probably be guided by County Public Health Department, who would simply provide those lists of individuals who need to get the vaccine after they've pre-registered. So it's not like you as a village can call them and say, hi, come vaccinate my member. It needs to go through county. If that changes, I will let you know so that we don't have to be so bureaucratic about it. Because we love our bureaucracy. We cherish it and we hold it very dear, close to our hearts. Eddie's like, oh my God, this woman, I can't deal with her anymore. Okay, everybody, are we done with vaccinations? Any more questions about that? No. I will say, can I just say, I think it's awesome news to hear that so many people have already gotten the vaccine. Eddie, that means you can just feel, guilt-free, just get on those websites and get yourself a vaccine. You are not trampling anybody else's priorities. Socially minded. Equity Eddie. Okay. If we are not talking about any vaccines anymore, I'm going to hop to the next exciting agenda item, which is Lifelong Home Coalition, and I'm going to hand it over to Joni.
Hi, everyone. Thank you so much for allowing us to be part of your meeting today. We're very excited to be here to talk about the Lifelong Homes Coalition and to give you all some more information about it. Again, my name is Joni. I work at Rebuilding Together Montgomery County as the AmeriCorps Client Outreach Coordinator. And I'm actually going to go ahead and let all the other staff from Rebuilding Together and Habitat for Humanity introduce themselves one more time and maybe say their position. So I'll pass it off to Lindsay.
Everybody, my name is Lindsay Loon. I'm the Senior Manager of Program Services at Rebuilding Together Montgomery County. And I'm looking forward to working with you all more as we move forward.
Katie, why don't you go ahead?
Sure. So I'm Katie. I'm the project manager at Habitat for Humanity Metro Maryland.
And Becky.
Hey y'all, I'm Becky and I am the repair client coordinator at Habitat for Humanity Metro Maryland.
All right, great. So again, we're very excited to be here and we have put together a little presentation for you all to give you more information about the Lifelong Homes Coalition and kind of introduce you all to our organizations as well. So I'm going to go ahead and share my screen now and put up a PowerPoint here. All right, and can you all see this?
Yes.
All right. All right, so what is the Lifelong Homes Coalition? So put very broadly, the coalition was created to help connect people to social support services and other resources in Montgomery County. And the coalition is still evolving, so we're still working on defining its exact role and how the coalition can actually be used to help people. So who is part of the coalition? Our current members include both, as I mentioned, Habitat for Humanity Metro Maryland and Rebuilding Together Montgomery County. We are the housing resources that are part of the coalition. We also currently have the Village of Tacoma Park and the Village and Silver Spring Village who have joined us. And we have Montgomery College as one of our resources, and of course, the wonderful Pizit. So who does the coalition serve? So we look to help vulnerable populations in the community. So that would include homeowners who are income qualifying, older folks, people with disabilities, veterans, and currently those living within the areas of the Silver Spring Village and the Village of Tacoma Park. And we are also very interested in helping to connect those who might live in those areas that have villages who would like to become involved with the villages, but may not know enough information to actually get started on that process or may need us to help connect them directly. So how can the coalition help? So as I mentioned before, very broadly, we help provide connections to social support and other resources. We can also help provide social connections for seniors who are often in more isolated positions, especially now, given the pandemic world we are currently living in. We are also, as I said, very interested in helping folks who live in the area where there might be a village to actually become members of that village if they'd like to. And we may actually be able to help with monetary support in some cases with village membership fees if folks who would like to be part of villages may not be able to afford it at that time. And then, of course, access to home repair services, which is where both Rebuilding Together and Habitat for Humanity come into play. And we do all sorts of home repairs as well as accessibility modifications, including health and safety improvements, basic handy person repairs, weatherization work, and then even things like seasonal yard work or perhaps more cosmetic things as well. So our impact can look like a variety of things. We really strive to improve the physical and mental health of homeowners. We work to create safer living spaces as well as reduce fall risk and prevent injuries in the home. A lot of our accessibility work is also specifically geared toward helping homeowners have greater independence in their homes and therefore greater ability to age in place as long as they would like to in their current residence. And then, of course, increased homeowner pride, because we all feel more pride in our home when we feel that it's a comfortable and safe space for us to be in. And then, of course, creating stronger communities. And that comes into play with having the coalition members become involved, and then again, helping to connect folks who may want to become involved with villages to the villages in their area. So I'm going to turn it over to Katie and Becky to give a little bit more specific information about Habitat for Humanity Metro Maryland.
Sure. Thanks, Joni, for putting this presentation together. So for Habitat for Humanity Metro Maryland, kind of basic information here on this first slide. You can see that, we are one of more than 1,100 affiliates nationwide. So we operate a little bit like a franchise almost. And I believe it's somewhat similar for Rebuilding Together, not to be redundant. But so in functioning like a franchise, we serve a specific area. We are called the Metro Maryland affiliate. What that means is we serve Montgomery and Prince George's counties. So we have been in operation for nearly 40 years. In fact, our 40-year anniversary is going to occur this year, which is exciting. We have built and rehabbed nearly 100 affordable homeownership opportunities. Obviously when people think of Habitat for Humanity, they're thinking of, swinging a hammer next to Jimmy Carter. With our affiliate, that is very much the case on one side of what we do. And on the other side of what we do, we work directly with existing homeowners to help them attain critical health and safety repairs in their home, things like accessibility modifications, and also weatherization. Yeah. And so diving just a little bit deeper into the programs that we have kind of generally and what those programs offer. We've got our home repair program, which kind of overarches across a couple of more particular sub-programs, which, if there's any specific questions, we can get into the nitty-gritty on that on a case-by-case basis. But generally speaking, we have a home repair program where we're able to implement critical health and safety related modifications in the homes, and then our weatherization program, which is aimed at addressing the overall energy efficiency of a home, treating it almost like an envelope. So making sure that the home is adequately air sealed, that the air quality is being preserved with adequate ventilation, and that obviously we're lowering overall utility bills for the existing homeowner. For each of those programs respectively, we have budget caps of up to $15,000 per home for home repairs and up to $10,000 per home for weatherization. And of course, those caps are kind of eligibility contingent. So we do, assess an applicant on paper. We also come into the home directly and assess the home for those critical health and safety concerns, as well as weatherization need. So general eligibility kind of stipulations, these again kind of overarchingly apply to all of our programs, whether it be home repair, weatherization, or any of those sub-programs I mentioned earlier. So obviously, because we serve Montgomery and Prince George's counties, you must be an existing homeowner in one of those areas. You must live in the home which is to be repaired. So the home you're applying for repairs on must be the primary place of residence. You must have lived in the home for a minimum of 1 year prior to applying. Part of this is because we do obviously want to make sure that if we're capturing a home's needs, we're capturing as many of that home's needs as possible, but also from a weatherization perspective, it really does give a better sample for how the home functions as a whole. So what are those energy efficiency deficits? Where, can improvements really be made, and what are those utility costs associated with that? Having been in the home for a year kind of allows for the building of a history of that. You must also have current homeowners insurance. We obviously, as a licensed builder, we do carry our own insurance, but we like to make sure that all parties involved with our programs are adequately insured all the way around. And then we do have income guidelines for our program. Now, to be totally straightforward with this, we tried to make our income guidelines as simplistic as possible. So they do go off of the area median income for the entire DMV metro area. So that might be a little bit different from any Montgomery County AMIs that you're familiar with. So these numbers may vary a little bit away from AMI figures that you see more regularly. But we just go off a simple AMI, gross household income, and obviously that's adjusted for household size. There is no minimum income needed to qualify. Have a purely zero income household, and that household could in theory qualify. And we also do not consider assets. So I know that a lot of times we get concerns, particularly from seniors, even if they're on fixed income, if they have assets, how does that come to play? It really doesn't for our programs.
Great, thank you so much, Katie. And I'm just going to talk a little bit more about Rebuilding Together Montgomery County, which is our other housing resource that's a member of the Lifelong Homes Coalition. So Rebuilding Together, similar to Habitat for Humanity, is actually a national organization, and we are one of more than 130 affiliates across the country. We were founded in 1990, so it is actually our 30th anniversary in our fiscal year this year. We've helped more than 2,200 households in the Montgomery County area. And when we partner with local volunteers, businesses, and contractors to provide our services in the community, although we're not using volunteers right now because of the pandemic, but we are still doing work with local contractors, and we try and always have a good number of business partners available to us to provide all of the different services for our homeowners. And each year we also organize large-scale volunteer projects that help to engage the community in helping their neighbors with rebuilding projects, including National Rebuilding Day and She Builds projects, which are female-led projects within the community. So our services include critical home repairs that can look like a wide variety of things, as you see here, including plumbing, roofing, flooring, carpentry, electrical work, appliance replacement, and more. The work that we do is really specialized to the homes that we're working with, and we try to address all of the different critical repair issues that we see throughout the home and outside of the home. We also do accessibility work and accessibility modifications that can include installation of grab bars, ramps, railings, anything that would make the home more accessible to someone living there for their ability to get around and feel comfortable and safe. And again, reducing fall and injury risk with those additions. And we work closely with each homeowner to determine what repairs and modifications we are able to address based on both the resources we have available at the time and the needs or the most important issues to the homeowner. So we don't have a specific cap on how much money we spend per home, but we do work collaboratively to try and address as many of the critical home repairs in the home as we're able to. And to be eligible for our program here at RTMC, homeowners must own and live in the home that will be repaired. You must be current on mortgage payments, although not being current does not automatically disqualify you if you can provide us proof you are working to modify the loan on the home and can provide proof that you're actually meeting those new modified payments. The homeowners must remain in the home for 2 years following the completion of repairs. Home equity value must be under $400,000, and the total gross household income must not exceed the limits that are listed in this chart on the right-hand side. And these limits are also based on area median income specific to Montgomery County. So unlike Habitat for Humanity Metro Maryland, we do not work in other counties. So this is, these income limits are specific to this county. All right, and so to kind of wrap up here, who can apply to Habitat for Humanity Metro Maryland or Rebuilding Together Montgomery County? Sort of what is the Lifelong Homes Coalition? What does it mean in terms of being able to apply to our organizations? So both of us operate as independent organizations and are available to the public at all times as individual resources. So villages can actually always refer members to either program. They do not have to be part of the Lifelong Homes Coalition to do so. However, becoming a member of the Lifelong Homes Coalition does come with several added benefits for village members. And that includes project prioritization, additional support, helping to fill out the application from those within the village itself. And then also collaborative approaches with the village to implement services. And we try to make sure that we are involving, the village if the village member does want that additional support and does really need sort of liaisons from their surrounding community to help be there throughout the process. So just to summarize here, the goals of the Lifelong Homes Coalition, we are looking to strengthen the existing relationships that we have among our current members. We're looking to build new relationships with other Montgomery County villages that may be interested in becoming members of the Lifelong Homes Coalition. And part of this presentation is, of course, to make you all aware that we do exist and that we are here as an available partner in the county to provide these resources. We are looking to support village members and also, as I mentioned, aspiring village members who have critical housing needs and then may also want to be connected to a village in their area. And then creating sustainable referral networks and lasting partnerships. So we hope that we can really build upon this and really build our relationships among the Lifelong Homes Coalition members going forward. So we'd like to open the floor now to any questions that you all may have for us. But before I do so, I do want to mention that Pazit will be sending out this PowerPoint along with toolkits that both Rebuilding Together Montgomery County and the Habitat for Humanity Metro Maryland have put together that include more resources with FAQs, with more specific information about how to apply for us. And so that will be a link to a folder where you can actually look inside and find those resources and learn more information about our specific programs. And again, the PowerPoint will also be included in that. So if you'd like to take another look at it, read through anything, you're more than welcome to. And for anyone who wasn't able to be at this meeting, those resources will also then be available to you all because they'll be sent out after this. So now I'm going to stop sharing my screen. And we'd love to take any questions that you all have. So anyone can jump in from Rebuilding Together Habitat staff. We may all have different areas of knowledge here. So yes, Edgar.
Hi, two questions. One, are you limiting to Tacoma Park and Silver Spring, or are you really looking to bridge out of those two geographic communities throughout Montgomery County?
Yeah, that's a great question.
Let me ask you the second question, and then I'll shut up. The second question is, given the income eligibility requirements, have you considered sliding scales for folks who might be right around those numbers but above them?
Yeah, so these are both great points to raise. So we are definitely looking to strengthen our relationships with both the Village of Tacoma Park and Silver Spring Village. We'd love to do more work there. And we would also like to expand to other villages in the county. So part of the reason we really wanted to come here today and speak to you all is to let village members from other villages who may not be as familiar with the coalition or who may not even have heard of us before, to let them know that we are here as an available resource. And we are very interested in seeing if we're able to partner with more villages to become a better known resource to those members, and then potentially, hopefully, to actually bring them into the Lifelong Homes Coalition as one of our members. So to have a really stable partnership there where we're able to be a direct source of help for those folks in the village. And in terms of sliding scale, that is something that I can tell you within our organization, Rebuilding Together, we are looking at trying to see if it's potentially something we can implement in the future. We are aware that, there are folks who may be on the border between whether they would qualify or not. And so we are looking to see if we can try and make that a little bit more equitable in how we're able to help folks who may not quite qualify for our programs. And if anyone else would like to jump in about this as well.
Yeah, actually to kind of speak on behalf of Habitat insofar as income guidelines are concerned, typically, because it's not uncommon that we have folks that apply for the program and their income falls, just a smidge above that income cutoff. So when we're looking at assessing an application, we try to be as flexible as we can with the applicant. It obviously does depend on the funding source. So sometimes we have funding sources that are very strict in the income requirements that they put forth. And some, we can be a little bit more flexible with. So we do try to work with the applicant directly in order to kind of figure out what we can do still to bring them into the program. And then kind of generally to your first question, I believe, Edgar, I wanted to mention too that, we're providing all of these resources today for your all's benefit, whether or not you guys want to partner with the Lifelong Homes Coalition. We are still here as resources in the county. We are still available to receive referrals for your villages and your villages members. The benefits, as Joni mentioned in the presentation, are obviously collaborative approach and prioritization of projects, but that should not undercut the fact that we are still resources available in the county if you have folks that are members that are struggling to make critical health and safety repairs.
Thank you, Katie. Does anyone else have any questions for us?
I think
Don't be
Eddie has
shy.
some follow-up questions. Go ahead, Eddie.
Oh, yes.
Well, I do have follow-up, but if somebody else wants to jump in.
No, go ahead. No
Okay.
problem.
Okay.
My question was the same as Eddie's.
Okay, and the follow-up is basically, I'm thinking obviously of Potomac, Bethesda, a lot of Montgomery County communities who would probably love to partner, but a lot of our members probably would not meet the income qualifications. However, there's a part of me that says, food for thought, would you consider, and you don't have to answer now, but would you consider people who have the assets who wouldn't need the actual dollar figures that you bring to the table and could pay those dollar figures out of our own pockets and still be a partner and still use your resource, your people power for the work, but in essence, provide people who could afford to pay you to do the services and the materials, but still want to support your organization by doing it with our own assets. Just food for thought. You don't have to really answer.
Daddy, full disclosure, I am on the board of Rebuilding Together, Metro Montgomery County, blah. And I have been asking, you and I are with the same wavelength. So since I joined the board, I've been advocating for that. And I think that there is enough interest in developing new programs. This requires a major policy shift on the organization's end, but I think that there is enough recognition that there is a tremendous need there, both financial, but also, we've talked about the issue of trust, of people being scammed or price gouged when they live alone, and having somebody you can trust come in and do the work is worth a lot of years and healthy and money in your account. So yes, I think that this will happen and happen pretty soon. And I think the fact that you guys are asking for it would also encourage the organization to proceed with that action.
It would certainly open up avenues.
Yep.
Yes, no, thank you so much, Pazit, for diving into that a little bit more. So that is what we're kind of looking at doing with our sliding scale in terms of creating a program where we would be able to have folks who have the monetary resources to pay for repairs, be able to, come into our program, and we'd be able to help them. And as Pazit said, be a trusted resource so that homeowners know they're not getting scammed, they're not getting taken advantage of because they are, in a more vulnerable position. So that is something we are looking to try and implement, and knowing that it's something that the villages are interested in, and that people may be more likely to, be able to come to us with that option. It's certainly something we're going to try to push for if we're able to in the coming months as we continue to develop our program with it.
I have a question on the equity, $400,000 equity in the house. So I'm in Chevy Chase. The houses, a tear down is considered $800,000. So would we be ineligible for your assistance?
That's a great question. So this is actually something else we've been taking a look at in our program to see, if we are able to kind of modify this requirement based on sort of the holistic view of the application. So similarly to what Katie mentioned in terms of, having some flexibility to approve homeowners who may, fall slightly, outside of our qualifications. home equity is one we have been more flexible with in the past because we are aware that in certain areas of the county, you know, homes are worth quite a bit of money. And sometimes that home was purchased for far less many, many years ago. And a lot of it has to do much more with the area being very up and coming and, you know, price values increasing significantly over the last few years. And so that is something that we do again, look at holistically with the application. So in terms of being able to qualify the homeowner, we wouldn't be able to guarantee that we'd be able to if the home equity is above our stated limit, but it is something that we again take into consideration with the rest of the application and have some flexibility to adapt. And again, we are aware that with home values being so expensive in this area that that may sometimes be necessary because we don't want to turn anyone away who really does need help. We are just trying to help those in the most vulnerable positions who have the least means to do repairs. So again, we look at it holistically in that case. Yes, Constance.
I just wanted to add another dimension. I am a great believer in the Robin Hood principle. And in this case, I think what Eddie and Erico are talking about also certainly applies to us. You could have a separate division, you know, that was in fact financed and charged at a somewhat higher rate. We here in Friendship Heights would value just an education session because the issue of how people get repairs done or whatever modifications done in our area, because they're apartment buildings, really depends, and condominiums really depends in part on what's available in the apartment buildings. But we sure could pay for an education session about what you should think about because we've got a lot of people who are in denial. And who they hire to do this could be separated from just the basic knowledge that's involved too. Now, I think this is a great service. But if there's a way to make it available to people who are higher income and who have higher housing values, we certainly would be, and including those who have condominiums, we certainly would be a potential candidate.
Yeah,
I also want to add,
thank you for bringing that up.
I think that one of our plans at the coalition is to start with you guys as leadership, but also have a village-wide event as part of the shared program potentially, and inform individuals about the programs as they are right now, as well as plans for the future. My guess is that most of you do not know exactly how much people are making amongst your membership, and it's possible that some of them do qualify even within the current guidelines of these programs. And so just the mere option to inform your membership about these programs as they are right now could be of great value. So we're going to look into something, I don't know, in the late spring, so that people really do become aware of this benefit to them as a member of Montgomery County villages. Yeah, Lisa.
Can we get a copy of the PowerPoint?
Yeah, Johnny's going to send it. I'm going to forward it to everybody.
Yeah, so we'll have the PowerPoint, and then as I mentioned, we'll also have a couple additional resources provided for you all with more specific information about each of our programs at Habitat for Humanity and Rebuilding Together. So if you're interested in diving into a little bit more of the specific details, that will be there for you as well. Nancy?
I have a question. Burning Tree Village has something we call a services directory, and this is a directory of vendors or service providers that our neighbors have had a good experience with. We make clear that we are not vetting these people, but we list, you know, plumbers and different roofers and different kinds of vendors that people have had a good experience with and have felt comfortable with. We are going to be publishing that, updating it this spring, and I was wondering if we could have some kind of summary about this program in there, because that might be an addition that would apply for some people.
Whatever we give you, Nancy, when we send the resources, you can just cut and paste and add to your resource directory.
Yeah, well, I guess I would want to know something more about how the issues of income limits or housing values have been resolved.
Yep,
They
you're right.
have been by then, obviously.
So maybe we can hold off until we get some resolution on that.
Thank you.
All right, thank you so much. Lifelong Home Coalition members, Katie,
comment.
Joni, Becky. Oh, there's more question? Miriam, go ahead.
One of the things I wanted to mention is that over the years, we have often asked if people would like to volunteer to be in their house when service providers come in.
Yeah.
And that's a service that's very much appreciated. It helps prevent scams. It gives a second opinion and a certain degree of protection that people feel.
Yeah, absolutely. And that's one of the things that we're looking at in terms of when I mentioned the collaborative approach with the villages. That would certainly be something that we'd be looking to do, is to have someone there who the homeowner trusts, someone they know from their village, to really, as you said, kind of act as a second eye, make sure that everything going on in the home is really not, taking advantage of the homeowner. And so that is something we would look to do with that collaborative approach when we partner with villages.
Something else I just thought of is that when the fire department and Meals on Wheels, who are partnered, go into homes and they see things that are unsafe and that they don't fix on the spot, they might get in touch with you, or you might get in touch with them by general principle. The name is Jim Resnick, is the person that does that. And that might be another good part of the coalition for you.
Thank you. Yeah, we'll look into that.
Yep. That's a really, really good idea. If you guys need help with connecting to somebody from the fire department, let me know. Jim Resnick is the person to talk to. All right, so we have a few more minutes before we need to adjourn, but I do want to open it up to other issues, questions, suggestions.
Kazit, if I may say one more thing really quick here. Along with the materials we'll be sending out, we're also going to be sending out a link to a survey. And in that survey, we'd love for you to give us any feedback that you may have, again, about what we've told you all today about the Lifelong Homes Coalition, about our organizations. And so if you'd fill that out, we'd be very appreciative, and it'll be very, very helpful going forward in terms of how we're able to strengthen the partnerships. Thank you so much.
So much, Joni. All right, Miriam.
On a totally different topic for our last few minutes, I've been reading in the scientific literature and also in the papers about increasing concern about the coronavirus morphing into different forms that may not be very sensitive to current vaccines. And this implies that we're going to need follow-up vaccination programs, the equivalent of boosters. I hope that we can learn from the current experience, which continues to be mixed and not so great, that we need to plan in advance and not scramble when things happened yesterday. And if there's any way you could get the county to deal with that issue, it would be very helpful. We anticipated it and were really ignored.
When you say yesterday, are you referring to anything specific?
No, I'm referring to being.
Oh, as in the past, as in like abstract past. Yeah, I think there's a lot to learn from the rollout of testing. If you recall, that was a big stressful deployment period, and now vaccination is similarly as frustrating and anxiety provoking. I think that once we have systems in place, the next round would be easier. I hope so.
Right now we're behaving as if almost all the people 75 and over have been vaccinated, but it's really a very small percentage of people that are getting vaccinated. It's really shocking. Something like 8% to
So
20%.
the vast majority of 75 plus have been vaccinated, not the majority of people.
know?
Because we have data from Immunet, which is the state-based data on who got vaccinated. We have access to everything, including those who got vaccinated with Giant, Holy Cross, Adventist, and all the rest of them. I will also say this, that the food access call center that I'm running had also taken upon itself to make some calls to individuals who have not been reached out yet. And just from that experience alone, close to 70%, if not more, it depends, tell us that they've already gotten the vaccine. So this is why we need you guys to help us find those who haven't gotten the vaccine, so they reach to us. What's going on with me today? As soon as they can, so we can get them on the priority list for vaccination.
Pazit, I might add that we are a self-selecting group. Our people, our members, are people who connect and who are, it's a self-selecting group. There are still people within our communities.
Yeah,
that's
true. But I'm talking about people who are randomly selected from our pre-registration list, which is a pretty wide list, and most of them have already been vaccinated. Although I will recognize, and I think that we in the county are seeing the vaccination effort as a kind of a two-pronged approach. One is we need to get as many people vaccinated as possible to achieve herd immunity. But at the same time, we recognize that there are certain populations that are harder to reach and require greater effort. And so with this kind of population, you will not reach the high masses quickly, but it's more about the sustained effort in reaching out to people, even if it's not in large quantities every week. So specific targeting to populations in different zip codes, different communities. Eddie.
Sorry. I don't know if you guys have heard that the New York CDC has issued new guidance this morning, talking about the family situations. I'm a little concerned that people are going to jump the gun again. I know that I already have one village member reach out to me before this call saying, what can we start planning on events for all of us who have been vaccinated? And I chose not to respond immediately because I figured I had to really sit on it and not respond to what was in my mind the second I read it. But I guess I'm just having to throw up the caution flag to all of us. So that's it. It's in the New York Times.
Yeah.
I just want to say Northwest Neighbors Village sent out a really good email yesterday engendering caution on that score. So I think, we all can do the same thing.
Yeah. Yeah, the variant is highly unpredictable. I can say that, in Israel, even though close to 5 million people have been vaccinated already, the rates of infection have not come down because of the variants. So this is a serious concern. Abby.
But one change for our village, which we're going to discuss at some length tomorrow at the board, which I hope will take effect. I know a lot of villages have been doing rides and services, but we have not. But now that a number of us have been vaccinated fully, we've changed our protocols a little bit, asking for the intake person to ask, have you been vaccinated? And our feeling is that if we follow those protocols, if the driver's been vaccinated, if the rider's been vaccinated and they want to use our services, that is a change for us. We are going to start, I hope, giving rides again and providing services again.
Excellent. Which remind me something. You remember some of you have purchased their plastic sheet separators between drivers and rider. There may be a pocket of money I could tap in to help with that for additional villages who think that would make a difference for them in terms of increasing and boosting volunteer rides. I need to get a sense of how many villages would be interested in such a product, or if you have any other PPEs or other things you think would help you move this forward. So just shoot me an email and I will add that to my list. Lisa.
It's a little different, of course, but in the beginning of the pandemic, the county supported several villages to get the Zoom platform going.
Yep.
It really gave us a jump start. Will that be happening again for the renewals?
Yeah. Anything that supports the integration of more villages working together, toward shared programming and getting more people access to your programs. Yes.
That's great. Thank you.
Yep.
really helped to launch us into that world.
Yeah, simple things make a big difference. Also a reminder that WAVE is working on a conference for mature villages on April 19th, I believe. So save the date. I hope Mary Jo has some nice flyers to share. If any one of you is interested in serving on a panel that pertains to either sustainability or volunteer management, board development, financial fundraising or grant writing, please let Mary Jo know, because she's looking for people to lead some panels.
By the way, just on affordability of housing, a segue, we're holding an event on shared housing. So people wanting to share a room, etc. And this is a Montgomery County program called HIPS, and we're having an event on
You mean home share?
Home share, yeah. So we're
Yeah, I think
Chevy Chase at Home is hosting.
Have you posted that on the shared programming
Not yet.
platform?
I just checked. It's not up yet. We haven't put it on up. It's April 6th. It's not up yet.
Yeah. So Home Share is a really, really cool program that I have no biased opinions about, because I'm not their contract monitor, and they're so fantastic. So please let your membership know about this.
So in the next couple
Montgomery County.
Yeah.
Andy.
What's happening? What is happening on April 9th about this home sharing thing?
April 6th.
April
So
6th.
basically, the person is coming to speak and present on how to do it. That's it.
Okay.
Give you background on the program. It's a county program.
All right. Anyone else? Updates, questions, complaints, accolades? Nothing? Trish.
Hi, sort of tagging on to what Abby said about starting to provide rides and altering the protocols. I was curious if anyone is doing or attempting or planning any kind of in-person events for people who have been vaccinated and are feeling a little bit safer.
We are not keeping track of who's vaccinated or not, but we will probably open up for some in-person events in May or June. We had done the same thing in the fall when our internal task force decided the numbers seemed good enough and everybody was masked and outside. So we'll probably be doing outdoor small group events again then.
Okay.
We're planning optimistically mid-June to do an event to visit the Eisenhower Memorial and to have a guide meet us there. So Elizabeth, if you want to talk to me about that. We're looking at the statistics and see whether that works, and haven't figured out the transportation piece, but it's still a while away. So we're going to reevaluate it, but we're hoping that we could do that being an outside event.
Abby?
We've been doing consistently, except for a couple of the coldest months, monthly outdoor either picnics or restaurant, once the outdoor restaurant started, with our lunch bunch once a month. And it's been well attended. People are desperate.
All right, I'm going to stop recording. Anywhere, stop.